we had decided to go along with this topic. Obviously, it's very important. At the time of submission, though, it wasn't necessarily as big of a topic, as big of a scramble. If you have not engaged in telehealth therapy or worked with this type of avenue in the field. However, we were pleasantly surprised to know that this presentation in particular has all of a sudden become a big topic. We're hoping for this to be an interactive discussion-based presentation. We want to answer as many questions as we can. Obviously, we may not have the answers to all of the questions, but we are available for resources and we will find those answers for you. So if anyone has questions along the way, please feel free to jump in. It will not be viewed as negative or unwelcomed. Like I said, this is an interactive presentation and we want you to get as much out of this as possible. So if you want to take a few minutes, we did attach a QR code for you. This is our PowerPoint presentation. We do have also alternative resources that I can kind of browse through and show you. If you are interested in that, please put in the chat box your email address and we are more than happy to provide those additional resources for you today. So I'll give like maybe 30 seconds for people to take a picture of that and save it. Okay, let's go ahead and move on. So again, talking about applicability and why it's so important to kind of talk about virtual boundaries in our profession, we noticed obviously that a new norm has risen or came to light as the COVID-19 pandemic has, it's considered a pandemic, it's an outbreak. Clientele are looking to get services via telehealth. They're trying to maintain a sense of safety. If you are in an agency setting, agencies are probably scrambling a little bit with protocol, depending on if you are, an in-person agency versus a telehealth agency. A lot of counselor education programs have not bridged this gap. We have not found in our program here in Pennsylvania much exposure to technology or the infusion of technological advances in our clinical practice. It has been based face-to-face. Now we do tape our individual practicum courses and some of our field experience, but the implementation of telehealth has not been its own separate course. There are a lot of policy changes within facilities that we're finding, whether that's private practice, agency, or telehealth regarding COVID-19. So making sure that we're up to date with our policy procedures and maintaining boundaries and safety is ultimate key. And this has happened so quickly that a lot of people have not sought out preparation or even thought about this realm. So a lot of people are looking for training in the clinical field. A lot of people are looking for answers to questions, making sure that they are fitting in those guidelines for health insurance panels as well as policy at their facility. So let's talk a little bit about examples of what we mean by virtual counseling or social media platforms. Today we'll be discussing the outlined Facebook or Facebook Messenger, social platforms, Skype, FaceTime, Zoom, DocMeIn. These are all some of the more popular ones that clinicians seem to be gearing toward at a quick whim, or agencies seem to be gearing toward at a quick glance. But I'm wondering if anyone knows if any of these are not HIPAA compliant.
Brittany, I'm thinking the Facebook Messenger is not HIPAA compliant.
Yes, definitely. I 100% agree. Facebook Messenger, Facebook owns all of the rights to Facebook. So when we are talking about Facebook, we don't own that. There is no privacy in that. There is no, restrictions to that. They can take that information and use it however they so choose. So definitely. Anything else?
I know, Brittany, I'm seeing some of the chat, and I know someone just mentioned Doxy Me. That is one of the most popular ones because it is free and the clients do not have to download an app or download anything to be a part of it. And I think that is one that has been, pretty popular with private practices.
For sure. And thank you, Amy. I cannot see chat, so that's something we're going to have to be mindful of since I'm sharing my screen. I'm going to ask that you monitor that and kind of jump in and help out in that sense.
Sure.
But the other one, if you get the non-subscription Zoom webinar services, similar to what we have here today, the original non-fee related one is not HIPAA compliant. There is no safeguarding of information, sharing of information, conversation. If you do pay for Zoom, subscription or membership for Zoom, that one is HIPAA compliant, but the baseline services, the one that we are seeing here today, this is not HIPAA compliant. So that is something to keep in mind when working with an agency or engaging in private practice.
I also wanted to point out that I know a few other people on the chat were talking about the BAA, which is the business associate agreement, because I know on DoxyMe you have to fill that out and have it on file. That is something that is really important to have as a safeguard for yourself. So I did notice that people were commenting on that. So I think at whatever site that you're on, that should be something that is being completed. So we're going to jump right into a little bit of discussion on the ACA Code of Ethics. Even from 2014, we are lucky enough to have a code of ethics that was thinking a little farther ahead, because in section H it is all about distance counseling, social media, and technology. Something that is very important is the informed consent. I know that we're going to get to that a little bit later in our presentation, but it clearly spells out in our code of ethics what needs to be in our informed consent. We have to really discuss security, as we were just talking about, being on platforms that are HIPAA compliant, letting clients know that we have all of these safeguards in place, discussing confidentiality as part of our informed consent, of course, that we want to put in there that we cannot control if the client is using a platform in a public place, if people are hearing the conversation, if where we are, we want to be in a safe space so that no one is overhearing our conversation. We also like to talk about the security of confidentiality. I mean, we're all well aware of, how information can get leaked, how things can get out there. And we want to ensure, our clients that we are doing our due diligence to prevent that from happening. All right, someone has a question here. Let me check that out. Do both therapist and client have to pay for Zoom? It is to be HIPAA safe. No, just the just the therapist. The client does not pay for Zoom that way. Getting back to the Code of Ethics, access. I know that we live in rural Pennsylvania, and right now that we are having a lot of issues with clients not being able to get online on the internet. We are having to do some alternative, type measures, such as phone, because I know our insurance companies have approved video and phone services with certain plans. But that is something we also have to look at if we're going to make telehealth, one of our primary, means of counseling. Effectiveness of counseling. I am not sure if, I know down at the bottom of Zoom, you see a little reactions button that gives a thumbs up and thumbs down. So I just kind of wanted to get the feel of how effective some of the counselors are out there. How do they feel about doing online counseling? How effective do they think it is? I will share a little bit about myself that I work in private practice. I have kids from really little, like 3 and 4 years old, all the way up to adults. I have a population of autistic teenagers that I work with, and I have had some moments along the way of like, wow, this is really different with this forum because I'm not getting that interaction. I'm not able to, play. I'm not able to do some of those activities with my younger ones, that I'm really used to doing. And when looking at the Code of Ethics, they really spell out for us the effectiveness of counseling on this medium. And one of the things that I found really interesting when I was reviewing this is just making sure that you are trained in counseling for online, because it's not often the same as it is face-to-face. It is a different level of service, a different level of effectiveness, instead of being face-to-face in an office. So again, I think just us being good ethical counselors, reviewing these different sections of the Code of Ethics is very, very important. And we have another chat about someone giving their opinion that I believe for certain clients it's very helpful, using telehealth for pre-COVID clients, and they've adjusted really well. But a lot of clients are mourning, the loss of face-to-face. And I think that is definitely, something to talk about. And I'll share, before COVID happened, I use an online platform called Talkspace. I'm a counselor through that service, and I loved it. I still love it. But then now with all my private practice folks being online, it is, it's something, to juggle. Social media as counselors and clients. I am sure that we have all had some interesting experiences with social media at one time or another. But as a counselor, we've had these conversations of, if a client finds you on Facebook and they are messaging you, do you respond back? If they find your private page and they're friending you, how do you handle that? So we are going to get into that a little bit more as we are getting into the presentation, but the Code of Ethics spells out the idea of a personal social media account versus a professional account. So that is something we will, continue to talk about. Okay, so why is this so critical? Everything here is changing at such a fast rate. It's imperative for us as clinicians to keep up, abiding by the Code of Ethics, making sure that we are trained. And I know I've seen some messages about how to get trained, and I will post that when it's Brittany's turn for her slide. I have some, websites I can certainly pass along. But we want to provide that psychoeducation and awareness. And I think that's what our aim here is today, is to really talk about those issues of boundaries between clinician and clients, talking about the vulnerability, talking about how to be HIPAA compliant, and us as counselors having that self-care, while we're trying to juggle this new normal of being online. I know that, again, in rural Pennsylvania, we've had some issues between phones. We'll talk about this in a little bit, but if a client can't get through online, are we giving out our personal numbers? Are we creating a Google phone number? What are we doing about that? Because really, when we think about telehealth, we're not thinking about all of the layers that this entails. I mean, there's just so many things. When Brittany and I were preparing for the presentation, we were both just really overwhelmed by the amount of legalities and the amount of information that really is not even out there. So we have really enjoyed digging into this topic a little bit more for you folks.
So I have provided a case scenario for everyone today. I'm hoping Amy, my co-presenter, can kind of help with the discussion here with the chat. I have Jane Doe, a licensed therapist in private practice, is approved for virtual counseling via PMC for You commercial insurance. Jane engages with clientele via Skype in order to schedule clientele and host sessions in her practice. Early one morning around 6 a.m., Jane awakens to a message from a suicidal client whom she has not heard from for about 4 months, expressing they were going to kill themselves if she did not answer by 5:30 a.m. Jane begins to panic. What are some issues that we're noticing from this case scenario that I've provided today?
And feel free to unmute yourself and join in the conversation as we're, asking those questions. We had a response saying that one is response time clarification and another is emergency procedures. Emergency protocols. Does she know what town the client lives in?
Let's say no. Let's say this client came in 4 months ago for about 3 sessions. No, let's do a half an intake. She might have an address on file.
Length of time since last session?
It says here 4 months.
Back to informed consent, being clear about being an outpatient counselor with office hours. It's important to explain resources, crisis phone numbers, things like that. Kimberly wants to know, was the client suicidal prior to the interaction?
So let's just say the client came in for an intake, didn't really talk about some of the deeper issues. Let's say that suicidality was assessed at the time 4 months ago, but nothing was suspected or reported. I really like the dialogue I'm hearing. This is really good. I'm sitting here with a sense of happiness, a sense of joy with this in a sense, or confirmation, validation, because there are quite a few issues with this case scenario that I was trying to get at, particularly to the use of Skype and that disclaimer that everyone should be sending out. I know it sounds a little odd, but after every interaction with clientele via social media, a disclaimer or a blurb is expected to be announced, whether that's in your consent for treatment or like I do for Skype. Every time I have a session, I put this blurb in afterward to kind of understand that boundary and set that expectation, which we will be sharing with you today. Another issue that may arise is the location. I heard location, which my train of thought for this location is, if I'm doing telehealth services in Pennsylvania through a commercial insurance company, if this person is from California, I may not be able to provide that service. I may not be able to bill due to the lack of portability for licensure. So making sure that this person is in the state of Pennsylvania, is, their health insurance is still active, and the health insurance company is allowing this form of telehealth as a form that is billable for you as the clinician in providing that service. Again, going back to the consent, making sure that in the telehealth consent that there is a disclaimer about that, this is not a crisis approach. If you are in crisis, contact these numbers, take these steps, and making sure that that expectation as well is set. So some really good dialogue. A lot of things were caught during this. That's really good to hear and see.
And I think a couple other people were talking about the ethics about that in my private practice, we have a policy, of seeing, checking in once a month. If we have somebody, especially right now with everything that's going on out there for 2, 3, 4 months, they don't want telehealth, then what we're telling them, we're calling and saying, we can't just have you out here without support, because we are still tied to you. We are still, your counselor. So we've been doing closings. And again, it's at the client's request. We're offering all of the telehealth services that we can. And, many clients said, I'm not comfortable. I don't like this. I will close. And then when we go back to face-to-face, I will definitely be back. But the point is to know who's on your caseload and who is not being seen, because that's the last thing you want to have as far as a liability.
Yes, so check with your facility, or if you're in private practice, making sure that's in your consent for treatment. The facility may have a timeline expectation as to when you are expected to close those out. If you do not close these clients out and something comes back on you, that is a liability on you as the clinician providing that service or that facility.
Mm-hmm. All right, we're going to get into some best practices right now. And again, I cannot wait to hear some, dialogue on this as well. We're looking at scheduling. Now that we're working from home in theory, doing our telehealth, our children are off of school, spouses could be home. Scheduling is certainly not the same as it was, when we're doing face-to-face. Talking about boundaries with communication in the virtual world. Having that disclosure statement like Brittany had mentioned. The pitfalls to avoid social media, you know, if you have to engage or if something is happening that way, you know, how to make that appropriate and ethical. Again, talking about that virtual presence versus personal presence. Those are two different things because we're all different people in our personal lives than we are in our counseling life. And again, referring back to that ACA Code of Ethics, because that is our roadmap that is going to help us make those ethical decisions. Looking at supervision approaches, again, are we having supervision? You know, in a private practice, we were having it twice a month for an hour. You know, is that still happening when we are now in telehealth? If everybody is so busy on their computers, are we scheduling that, that supervision time? You know, we want to avoid burnout. This has only been the second week of telehealth, and I can tell you personally, I'm feeling it. Just trying to stay afloat of everything that is going on. We want to stay connected with our colleagues and our professionals. Like right now, this is so nice to know that everybody is on here and listening and sharing, and just staying connected is great. Seeking out the support. And like all of you are doing right now, attending educational seminars to understand this new realm that we're all navigating together.
I am sitting here and I'm wondering, I'm not sure where people are coming from, what states, what areas, but I know in the state of Pennsylvania, our supervision time have to be, at least in PA state law, say that we have to have supervision via face-to-face in acquiring licensure. I'm wondering in other states if we know what protocol is, if that is allowed via virtual or not, and what dilemmas you may be facing as we move forward from this.
And Brittany, somebody asked if this is being recorded for YouTube.
It is not. I am not recording this. However, if they need me to go back to the Q scan, I can do that for them. We have provided a scannable, like a digital scan code where you hold your phone's camera up to it and you have access to this PowerPoint. If you would like the additional resources that I will be showing you throughout this presentation, please just put your email in the chat box and we will send you all of those additional resources as well. So
maybe if you could do that, I'm sorry, towards the end,
Sure.
maybe as we get to the questions at the very end, if you want the resources, maybe throw your email in there, just so that I can kind of maintain it because there's a lot of chat going on.
Yeah, definitely. And while we're doing discussions and questions, I'll go back to the QR code scan PowerPoint slide. That way people can get what they need then. So moving forward, talking back about this social media presence, you know, just to get a little bit of a kick today, we all have that personal view of ourselves, that personal presence on virtual social media versus our professional. And my first ultimate line of defense is if you do not want your clients seeing that personal person, you need to set your social media to private and also have a separate social media account for your professional presence. We do not want our clients getting blurred boundaries or mixed expectations by putting our personal information out in a way that they can contact us. So if you see here, you know, you have your personal presence potentially on the left from a horrible college night gone wrong versus your professional presence, you can automatically see the difference in what persona you're putting out there. It seems small, it seems very minute, but I promise you, we all know that that first expectation is set by presence and interaction with people. Photos talk a lot. What we have on our professional Facebook page is not what it's going to be on our personal. If you do not want your children, you know, exposed to clientele, you need to set those to private and set a separate Facebook account for your professional presence. Responding to social media requests and messages. I'm wondering if people had time to think about whether or not they would respond to someone on Facebook if they had contacted them via Messenger.
Nope and no. There's a lot of no's coming up.
So
I guess my question is, would you respond? would you respond and say, or just
Amy, did you freeze?
you have face? I think, that's not how we can communicate.
Yeah, I'm not sure what that dialogue was. It seemed, Amy, that your connection was poor and I didn't get to pick up on some of that.
Oh. Okay, let me move. We're in rural PA. We're in rural PA, folks. I was just kind of bringing up the point of, do you respond to the message? Do you let the message happen, or do you just adjust? Do you just discuss it the next time?
Yeah, so again, having the disclaimer blurb that I'm going to be providing today is very important as a way of protecting you as a clinician and avoiding liability issues. I would also recommend having a dialogue next time in session about those boundaries and setting that expectation if they seem to be consistent or just not understanding in a sense. But you can set your Facebook Messenger, I do believe, it would come up as a message request, so you may not even see it if they're not your friend for your private one. Your professional one, putting that disclaimer, that blurb down. I did work for a drug and alcohol facility who had a very strict Facebook policy. We were not allowed to have a virtual presence or have any type of presence whatsoever, but we were allowed to put a disclaimer if someone were to find us on virtual social media, and that was per that company's policy. So some places do have that.
Some of the chat that we're getting is responding in session, having it in your informed consent. If they know how to reach you, that opens a door. So really, trying to keep those boundaries very firm. So best practices, with scheduling, I know some of us as counselors, we might see clients back to back to back, and have the billable hours, have the face-to-face hours. Now, is it feasible to do that? This is different times. This is different level of service. It might not be feasible for us to do back-to-back clients. Are we taking the time to maybe not, schedule so many sessions in a day, but maybe work more often? I think this is a big struggle again for myself, when I'm home and my kids are home and I have clients. How am I taking that time for myself? How am I taking the time to come downstairs and eat or get a drink or use the bathroom? Watching how we're scheduling is very important. Boundaries with communication online. This is a new one for me. I am not a big online presence, Zooming. I've just never had an opportunity until I started school to do this format. But I think just the idea of eye contact, comfort, body language, some of the things that might be missing here on an online platform that's not authentic to my true self. So that might be a struggle that everyone is having. And I think looking at that and acknowledging that and kind of even saying to your client, like, I'm sorry that our eye contact is a little off, but I'm listening and I'm here, and like leaning in and just showing them, that even though this is a different format, we can still use all of our counseling skills, but they just might look a little different. We were talking again about the disclosure statement, attaching to all social media forms of communication, having that blurb on there at the bottom that, Brittany had talked about. And one of my favorites is supervision. I love supervision. I find it so beneficial as counselors when we might be in our offices for 8, 9, 10 hours a day that we're not really connecting with our coworkers. To schedule that supervision so that we can talk about our clients. We can talk about, interventions that maybe we need to use or problematic issues with clients that we just cannot work out ourselves. So how are we getting those supervised hours now that we are in a telehealth situation? Is it phone? Is it Zoom options? But I really think that reaching out and having that access to your supervisor, especially again during this time, is so important. I know that at my office, we are, once a week, we're trying to do triadic supervision, with 3 of us. I know as a licensed counselor, some of our colleagues in our office that do not have licensure, we've been trying to offer that support as well. not just coming from the supervisor, but other LPCs trying to step in and support, other counselors. And again, staying connected to colleagues is just so important, because I think we are all navigating this together and seeing, how it is, how we're responding to it. People either really love telehealth or they really don't like it. So seeing where you are in that, with colleagues to kind of bounce ideas off of each other. And avoiding burnout. I think this is a really good one to talk about. The challenges of online counseling, the lack of that face-to-face contact. And I think this is where we're really mindful of how we are counseling. Where are we counseling from? Is it our dining room table if we're alone, or is it an office that we're in? Really watching about scheduling maybe difficult clients back to back. Are we packing our schedule like we talked about earlier? Really trying to have self-care. As counselors, we are preaching that to our clients right now, that self-care is so important. Make sure you do something for yourself. Make sure you have some physical activity, because it is very anxiety provoking. And us as counselors, we have to practice what we preach and really get out there and engage in self-care for ourselves. So I guess I'm kind of interested in what are, you guys all doing for self-care or to avoid this burnout. Someone's doing yoga and puzzles. That's great. Working out, candles, all good things.
Nice.
Hiking and music and running. Awesome. Oh, wine. That's my personal favorite. I love it. Taking walks, prayers, cookies. Wonderful, guys. This made me smile. I like it.
So I believe one of the former questions was, is there a way to get trained? Is there a way to get access to educational opportunities? And I don't have the link, but what I can show you, if you are a member of the American Counseling Association, which I highly recommend, this is the time now more than ever to be a part of this. They do have, I'm signed into my account, so you would have to sign into your account to gain access to this. But something I kind of stumbled across today was this 15 free continuing education package. So obviously I had to click on this, but they have, look at all of these resources. Now, I took the liberty, if you are not a member of ACA, but you still want exposure to these, I have taken the liberty today to download all of these resources for you. Please send us your email at the end of this, and I will take and send these all to you. I want to make sure that this information is getting out there. I did see counselor self-care, establishing personal and professional boundaries. These are all relevant to us today. Ethical issues related to the practice of online clinical supervision. Like I said, there are so many resources available. There are education seminars related to telehealth on ACA's website as well. This would be the powerhouse for you. Right here it is, online training course, telebehavioral health. I mean, this is where you're gonna find, the high quality, applicable education seminar sessions that you can really use in your everyday practice. NBCC as well. I don't know if any of you are NCC accredited. If you are struggling to find adequate supervision, you can go on NBCC's website and search a supervisor in your area. I want to really emphasize that just because maybe your facility isn't providing the support that you need, that does not mean that you are stuck without support. That means you go outside of that facility and seek that consultation to make sure that you are abiding by the ACA Code of Ethics and kind of covering your tail in some of this navigating of telebehavioral health. Do not think that you are stuck in an agency without support, because there are tons of people out there who are willing to reach out and support you. Again, connection with colleagues and professional supports. I know my facility, we've been hosting virtual get-togethers every Wednesday night. That is outside of that facility. That is us coming together as coworkers to kind of just let some steam out without without seeing each other in person, but still connecting, making sure that we're up to date. We have dinner together. It gets rowdy sometimes, but that's just a way of us maintaining that connection as colleagues and, you know, kind of reminding ourselves what we're doing and why we're doing it. Virtual conferences like today, this is a great way to stay connected, get that awareness, get that psychoeducation toward what is going on, what is changing with regard to telebehavioral health, teletherapy, and again, seeking out that additional support and communicating explicitly your needs and what questions you may have moving forward with this.
All right, of course, as we get back to, we were talking about the Code of Ethics. So now here we are with ethical and legal considerations. We were talking about the differences between states with licensure, with healthcare, health insurance. I know when this first started, we were calling in Pennsylvania, we were calling, you know, our health insurance companies that our clients have, and we could call 3 of the same people, say under Highmark, and each person's plan was different. One just offered phone calls, one just offered video, one offered something else. So it was really a struggle in the beginning because telehealth was not something that's usually covered via insurance. And what ended up happening is it seems like it's a blanket policy that MPA, everyone is eligible for some form of telehealth, and they have waived copays and deductible fees. So of course now, you know, we are really seeing an increase in, you know, in clients coming to see us. Again, as I mentioned, I am a therapist at an online platform, Talkspace. Well, in Pennsylvania, I can only see Pennsylvania residents. I cannot see clients in New York or California because that is just something within our license, and it's very important to call, you know, look at your state license website, look at your license, if you're an LPC or an LCSW or a licensed marriage and family practitioner, just really look and see what they are recommending. Because you don't want to get yourself into a bind, you know, finding out, like, who knows if we're ever going to get audited during this time, you know, who knows when they're going to look back and want to know what kind of services you provided, and you want to make sure that you're making the best ethical, legal, you know, decisions that you can, you know, as a counselor. I'm not sure if many of you do any billing or anything like that, but it's also nice to talk to your, you know, billing department or whoever's in charge of that to say, you know, are the copays being waived? You know, we heard this. Really follow up with some of that information, because I know for myself, I had clients paying copays of $45 or up to $50, and they weren't coming very regularly, like maybe once a month or once every other week. Well, now they want the services because there's no copay. So I think it's important to, you know, investigate some of those state by state, license by license. Another big one is contacting your malpractice insurer to assure that coverage will be met. You know, again, we don't know what's going to happen after this is over. We don't know, is someone going to, you know, talk about perhaps, you know, they were harmed or didn't get the best care, or God forbid, any of those situations. But I think looking at your malpractice insurance and really saying, what am I covered for? What are the regulations? What are the rules? What are the, you know, the scope of my skills as a licensed counselor or social worker or student or whatever, you know, you are. So I think the point of these slides is just to be mindful, to do a little bit of your research on your own license, on your insurance, and just so that you're always making the best, most informed decisions that you can.
And something I'll add to your liability insurance, a lot of people aren't aware, but most liability insurances do have a lawyer on hand 24/7 in which you can have consultation with. They are exposed to mental health laws via your state, as well as, you know, you as a clinician, and they can provide that free consultation as part of your liability insurance. So feel free to find out, you know, legally what that standpoint is and what that reference is. You can email them. If you go to your liability insurance website, they should provide that contact information. And like I said, most of them are available 24/7 for communication. So getting that clarification before making any decisions or following through with a session is very, very crucial for you. So again, talking about that, it kind of makes the segue into, why would I use a platform if I don't know anything about it? it's very, very important to gain the competence with the platform in which either your facility is advocating or that you are utilizing in your private practice. I've noticed in my facility, people are kind of just grabbing different methods and not really educating themselves on the specifics. You know, with Skype, you can have a phone number attached to that account. So making sure that your account is private and set to your work email, your work phone number, keeping that privacy out of clientele's eyes or out of the way, very, very important. If you can see here, email, phone number, yep. If you are working for an agency, it's imperative to attend staffing or consultation meetings to assure you are following accurate policy. I'm also noticing every day I get 3 or 4 emails, new policy, new policy, new policy, new policy. So making sure that you are meeting regularly with your supervisor on site or updating your own policy if you're in private practice to assure that you are in compliance. These are all key components to best practices and avoiding any pitfalls legally. I've also attached an example of a blurb that I utilize in my practice. This I send out after so my facility has approved Skype for some of our dialogue or our sessions. I attach this dialogue or this blurb after every session, reminding the client of the boundaries and the expectation that this is not a crisis hotline. This is not something that will be checked every day. And here are the resources to get you maybe the help that you are looking for at that time. It's a way to cover myself as a clinician practicing and also protecting the client. Mm-hmm. So if you're working in private practice or if you're with teletherapy, obviously you want to send a copy somehow, I'm guessing electronic with the way things are going with the pandemic, of the updated consent for treatment, which I do have provided an example of consent for treatment for telehealth. If you are interested in that example to kind of see what's in that and what the parameters are, we're more than happy to share that with you so that you get a better understanding and maybe tweak your own if you're in private practice. And again, being mindful of clientele not participating in telehealth services, it's important to close out those cases. Like I said before, if those cases are open under your license, that's you. That's your liability coming back. That person turns out, you know, in a critical situation, that can get tied back to you. So making sure that in your consent for treatment, that policy is explicitly stated that they will be closed out after a certain amount of time.
It is very important. As clinicians, we know documentation is everything, to making sure that you are keeping up to date on all of your documentation. You want to also make sure that you are using the correct codes for location, for the type of service. So again, that's more just asking your office staff, what codes should I be billing under? What is my location that I should be billing under? You want to also adhere to deadlines of your treatment plans and treatment plan reviews. Those still count, even though we are in the telehealth situation. You know, we have a blurb that we're using, you know, reviewed with client their 6-month treatment plan review. And, you know, we are signing that they participated, you know, via this new platform. But again, paperwork still needs to get finished and case notes still need to happen. You know, we want to talk to our clients about, you know, what this looks like for them. Like, how are they feeling, you know, about being in telehealth? We want to talk to them about any questions they may have. If they need to get a hold of me, or if there is a crisis, who do they call? They don't just want to go to the hospital anymore. I've heard that before, like, oh, I was having such a bad week, I should have gone to the hospital. Things were really bad for me, but I didn't want to go because of, you know, the coronavirus. So really having some safety plans in place for some of our high risk clients that we do have. You know, again, we want to make sure that we are identifying health insurance. You know, we want to provide continuity of care. You know, we want to also give our clients the reassurance that, you know, hey, we are going to be here. There's going to be a seamless transition. We are going to make sure that we're covering all of these, you know, all of these different things for you, from health insurance to co-pays, just to give them that peace of mind that I think everyone sort of needs right now.
And when all else fails, consult, consult, consult. If you are not 100% sure in your decision on a specific scenario or a a plan of action, it is never going to hurt to consult. So I 100% advocate that. Now I want to take 10 seconds, give you our information, specific our email addresses. You're more than welcome to take those. If you have questions outside of here, if we don't get to you on the chat, you're more than welcome to email either of us, both of us, however you want to do that, and we'll be more than happy to assist you. Before I go back to the QR code, I kind of wanted to show you what resources that we could provide on top of our PowerPoint today, really quick. Like I said, I took the liberty of downloading all of those resources from the ACA, those free 15 credits. So those will be available to you if you choose. Considerations for online therapy, counselor self-care, a COVID statement from ACA, personal and professional boundaries, healthy versus unhealthy coping strategies. There are interventions that are teletherapy compliant, happy, that I have provided as well. If you have some ideas or if you have some questions regarding interventions to use with clientele via teletherapy, I have also attached some great interventions approaches. Here is our informed consent example if you would like one for teletherapy and what we're putting in there. There's also a couple of talks as well, some talks from ACA regarding supervision, clinical practice, that type of thing. So there's a lot of great resources and you are more than welcome to have those. If you get dizzy, close your eyes because I'm going to hit the back button 100 times here.
Mm-hmm. Okay. All right.
So questions, discussion, like I said earlier in the PowerPoint or presentation, we have this QR code that you're more than welcome to scan. This will give you access to our PowerPoint and you can take all of the information. If you would like the additional resources that I just showed you, you're more than welcome to have them. You just need to send us your email. And now we'll open it up for any questions or discussions.
Yeah, if anybody, I know there's someone that asked, please just give our email, put it right here in the chat box. And I am taking emails right now. Thank you. Let's see. I'm not sure if anyone, like an administrator on here, has access to all of the emails. They're just coming so fast. I'm doing the best I can. If we could even post our resources to a forum or to something else.
The video it has been recorded and is recording still. So it will be posted and I'll be able to have the attendance from this course.
Okay, great. Okay, and
Yeah.
and you could get that to one of us via email?
The attendance?
Yes.
Yes, it'll probably take us a couple or a few days, but
No, and that's fine. And if all the the attendees here can hear that, if they just get the attendance to us whenever we do get that, even probably middle of next week, we can send you everything that we have. We would really appreciate that. Click the three dots.
Oh, Ebony just said that if you click the three dots in the chat, it allows you to save the chat to a folder on your computer.
Look at us go.
Okay,
Thank you for sharing that. I didn't know that.
Look at that. Wow. Little things, people. I love it. Message saved. Perfect.
Awesome.
Please remember, if you want to pick up CE credits for this, on the last page of the program, there's a link to a survey that you have to take by April 19th.
Well, we know that everybody's also doing, great work out there. So I hope it all continues. Brittany, they wanted to see our email addresses again.
Sure.
That picture of Britney Spears makes me smile every time I see it.
You have to take the survey for every course that you attended individually. You're welcome.